Good evening and thank you so much for joining us on this episode of Family Matters. My name is Purity Museo. The cases of coronavirus in the country continues to surge, and the country, or the peak, is yet to be arrived at, according to what health officials are saying. All the 47 counties have recorded at least a case of COVID-19, and Makueni County has not been left behind. And as counties face the litmus test of controlling the fast spread of this virus, what is the capacity of counties? Makueni County has already recorded over 100 cases of COVID-19, and cases could keep rising because of the eased movement of restrictions by President Uhuru Kenyatta in July this year. Tonight, we speak with Professor Kibwana, who is the Makueni County Governor, to bring us to speed on what the county is doing, the economic impact of this devastating virus, and how the county government is cushioning especially the most vulnerable into the community. Help me now welcome our guest tonight, who is Makueni County Governor Professor Kibwana. Thank you so much, sir, for making time for us. We appreciate your time and having us here.
Thank you very much. I am really happy to visit with you and to talk to Kenyans. All right,
and maybe I could ask you how the pandemic, the restrictions that have been imposed, we have staying at home, wearing of mask, and washing of hand, sanitizing. How has this changed your lifestyle as a person?
As a person, of course, this is a new culture. This is what is being called a new normal, when you do things differently, and when you also realize things that you thought were not possible are possible. Like, we didn't think that you can do meetings online. We always believed in physical meetings. But now we even save a lot of money because we don't have to do physical meetings, go all over the place, or like go to Nairobi, go to Mombasa. We can meet many of us virtually, and that's, you know, a new way. These days, you can't quite easily determine from one's facial expressions what they are thinking, because as you talk to somebody, you usually look at the face to determine, you know, their mood, you know, what you're talking to them about, how are they receiving it, and all that. So now you have to do a bit of guesswork. And even when people laugh, unless you just look at the eyes, you can't even quite understand they're smiling and all that kind of stuff. And of course, we're not used to washing hands all the time, sanitizing all the time, keeping social distance, because we like to hug, we like to greet, and now we are not doing those things. And sometimes you're just stretching your hand to greet, and you remember you are not supposed to do that. So in a way, we are changing our cultures, and it's really a new way of living.
And the new way of living has affected so many people, especially mentally. People have to stay at home, and therefore cases of vices such as domestic violence have been on the rise. Have these vices affected people in Makueni County?
That is true. There is a lot of mental stress because, unfortunately, people and families, for that matter, were not used to staying together. Like men, you know, we come to the house, you know, late. We want to stay in the house briefly. But now, when there is a curfew and you have to go home early, when you have to stay with your family, some of the men find that intolerable. And unfortunately, even within Makueni, we have had episodes of men attacking their wives, slashing even their hands. That has happened. We have had cases of family members abusing young girls, which is quite regrettable. So this proximity, which is seemingly abnormal, many people have not received it as a gift from God even, so that there is more intimacy, social, moral intimacy within the family. People know each other. They are happy being together. So we have a department of counseling. I think perhaps the only department of social support in the country. And they have really received very many cases, because in each of our sub-counties we have counselors, and they're receiving very many cases of people who need to be helped. And even the issues of drinking, and even when the bars are closed, people hide, and some, of course, buy from wines and spirits. So we are witnessing a problem of mental health, and in a way, I think this tells me that within our country, we need to accept that mental problem is just a disease like any other. And we should have counseling units, a counseling department throughout the country, not just for HIV/AIDS, but for usual mental health problems, including addictions, drugs, alcohol, and so on. And indeed, we thought within our hospital, the referral hospital, Makueni Referral Hospital, we thought that we should have a gender-based unit so that we receive both men and women who are abused and they are treated in privacy. We even developed a safe house where when somebody can't tolerate what is happening at home, they can go there. It's a private place. We don't say where it is. They can go there and then they can rest. They can be talked to by a counselor.
Would you attribute these efforts by the county government, especially to take care of the mental stress among people that is being attributed to the pandemic, to this report by InfoTrack that portrayed that people in Makueni County are the happiest?
Well, I mean, that caught us by surprise, because you would expect during COVID, people wouldn't really be happy. But of course, it's comparative. And in 2015, we were supposed to be number 43 out of 47. So we did very poorly. And during those days, there was a lot of stress because there wasn't agreement between the county executive and the county assembly. And we had about 3 years, really, of acrimonious engagement between those two wings of county government, and much was not happening, so to speak. But this time around, it's possible that people are happy even in difficult circumstances because we really appreciate our citizenry. We give them the confidence that in Makueni they are sovereign, they're in charge of their affairs because they do their budgets. There are committees of the people supervising each project. You can't get paid if that committee doesn't say you have done well. Even as professional people say, you know, you have done well. There are committees from the village of the people themselves responsible for their development, even with the development partners like NGOs and so on. So in a way, because we have this public participation, they ask us for things like they ask us for universal health care. And we said, okay, it can be done, 500 shillings per household per year to get treatment, whether it's an operation, it's inpatient treatment, you get your medicines. Apart from if you are in ICU, then that's subsidized. Dialysis, that is also subsidized. But generally, people receiving treatment, even for COVID, we don't charge. We don't charge. So it is possible because of the way in which we are approaching government and citizens feeling included and feeling it's their government. Generally, the leaders try to be servants. I think that could account for why they could be happy. Of course, we want them to be happy.
We want them to be happy. And do you think, as a governor, this should be duplicated in the entire country? Because there were counties that were listed bottom as far as having their people stay happy. Or what exactly do you feel where the gap is in terms of the leadership of this country?
Well, I think we as leaders are actually supposed to be servants. And in the Bible, it is said those the little ones are actually the greatest, like children, people who really don't take grudges, people really who are, you know, you send a child and the child goes. You send the child again and the child goes. Of course, you don't abuse them by making them do child labor. But that's the spirit of leadership, that people are ready to be sent, they are ready to serve. And that is really what should happen at the national level, at the county level, at any sector of leadership, so to speak. And I think devolution is getting us there, because now there are 48 governments, the 47 counties and the one national government, and there's a multiplicity of leadership. And so we should work together to make our counties and country better, our people, happier, because they're getting service delivery of all manner, and it's easy, and there isn't, corruption, and there is integrity. So that is really what should happen. And I think, although it is said that counties do badly, and we are accused of all manner of things, my experience as the chief whip of the Council of Governors now, my experience is devolution this 8 or so years has really changed the face of Kenya. And if there was more cooperation between the national and county governments, between senators, MPs on the one side, and governors, MCAs on the other side, I think our country would really go forward. Devolution is really a major plus for us. And even when I have said I will be a presidential candidate 2022, it is because I know, having the experience of Makueni, I can really replicate the fruits of devolution to the entire country.
The entire country. Let's talk about universal health coverage. We are on the road to implementation of UHC in the country, and even before the coronavirus, that was the agenda, and it's part of the Big Four agenda by President Uhuru Kenyatta. You have been on record, actually you launched one of the biggest mother and child facility. How would you rate or rank the healthcare system in the country, and are we headed in the right direction? Are counties doing what they ought to do to just help the head of state in achieving this agenda?
I think one of the areas of a lot of improvement in our country under devolution is the health sector. Because there were counties where there was no theater, where women were dying if a cesarean was necessary and they couldn't be taken to the nearest facility, which could be very far away, and particularly northeastern Kenya. This used to happen a lot, some parts of the Coast Province, even eastern. But when now there was money to the counties, one of the first things that most of the counties did was to expand health facilities. Like Makueni, we found 109 health facilities. Today there are 235. We used to buy medicines for 2012 for about 100 million shillings. Now we can do 300 million shillings. The staff, the doctors, the nurses, the clinical officers, all those staff, we have more or less doubled those members of staff. So I think when you rate the health sector before devolution and after devolution, there's been a revolution. And if anybody says to the contrary, it is just because they want to put counties down. So I think this partnership, like even during the this COVID-19 pandemic, actually part of the reason why it has not been as fierce in Kenya as the other parts of Africa, like maybe South Africa, North Africa, is because our system of the rural health sector is considerably robust. Therefore, I would say without hesitation that the health sector has been a very improved sector, and with more resource flow to the counties for the health sector, for other sectors, according to the functions that we have, I believe that devolution will radically change Kenya.
Mm-hmm. And because you said compared to before devolution and after devolution, the healthcare system has changed, but your opinion on whether this pandemic has found us unprepared, or would you say at some point the country was prepared in terms of the healthcare system?
The country could not have been prepared specifically for COVID-19 because it's a new disease. Just like Ebola. When Ebola happened in West Africa, it was quite challenging. So when coronavirus happened in the world, Africa was not ready. We were not ready, so to speak. Except that we were lucky because it started in China, it started in Europe, and that's where we learned what the disease is. So that by the time it arrives here, we are able to have some advanced knowledge of how to deal with it. And as a result, in Africa and in Kenya in particular, we haven't had the problems that have occurred elsewhere, particularly because of the deaths and the health sector being overwhelmed.
Let's talk about Makueni County. The head of state directed all counties to have at least a 300 isolation bed capacity. Have you achieved that? And number two, you mentioned we are yet to get to the peak. In case the cases surge beyond the between 90 and 100 that Makueni County has, to even 1,000, are there plans to expand your capacity to accommodate new cases?
Yes, we, as I said before, we have a facility for critical care in the referral hospital, our main hospital. And as of now, that capacity is taking 12 people. If we have 12 critically ill people, they'll be taken care there, Makueni COVID unit. We are receiving about 20 ICU capacity from the national government. So we will expand our capacity. We manufacture oxygen, and oxygen is very critical for managing COVID patients when they become critical. So there we don't have really a major problem because we even transport it to other hospitals within the county from the place of manufacture, that is Makueni referral hospital. There's something that we did which apart from at a place called Makindu, making sure that there are over 300 beds, and that's when really most of the treatment now is taking place. We have also developed our home-based care system so that, there are protocols, the public health people, know these protocols, and we have gotten community people to be part of this effort of combating COVID-19. We trained 4,240 community health workers who have been doing other community things, but now we brought them on board again to train them in terms of COVID-19, the protocols and so on. We even went further, and because we have a community government system, we have national government, we have county government, and we have community government here, or people's government. We trained about 46,000 people who are leaders, elected leaders by the communities themselves from the village level, so that each one of those, plus the community health workers, each one of them, because they are roughly now 50,000, can be in charge of 5 households, so that they can go there, they can see whether they are following the protocols, they can, if somebody has diabetes and they are old and they have high blood pressure, they can know who is vulnerable. They look at also the economic situation of people. So that is like an innovation, and that is why our home-based care, we think that that's where, if we had that upsurge you talked about, most of the people would be asked to remain at home and be seen from home. And if now a case deteriorates, that is when we would take it to these facilities. But having said that, the Makindu facility, we do it with KMTC. And come January, all the counties which are partnering with KMTC to have an isolation facility, the kids will come back to school. And if they come back to school, then you won't have that space. So we're also planning to build another facility, so that by January, if KMTC takes over their facility, we just withdraw our beds, our equipment, and we put it in a new place, because it's not clear to anybody when COVID-19 will cease.
As we wind up the economic impact of COVID-19 shortly, how hard has Makueni County been hit, and are there plans to cushion, especially the people who've lost their livelihoods here?
That's a big question. As Council of Governors, we are working with the KIPRA to come up with a post-economic recovery, post-COVID-19 economic recovery system. But even within Makueni, like working with young people, we are trying to make sure that there is a little, there are some opportunities for young people and vulnerable people, senior citizens, persons with disability. Our Department of Gender has been very active in terms of cushioning those people. We have deliberately decided that every project that we have, we will incorporate some young people in terms of apprentices, so that they are learning and they are earning some little money. We also have an internship program for also young people. We have a fund we call Tedeka Fund, where we give people loans at 3%, just administrative cost. We are trying to revamp this loan so that it can help people's businesses have gone to the rocks, to speak. Of course, we are getting a challenge in that loan system, because people we had loaned are telling us that their businesses have more or less collapsed. They can't pay, and so we are also dealing with that. But even with that difficulty, we are saying still we must encourage our people. We want to use the 30% of procurement to make sure that women, youth, persons with disability, other vulnerable, get some business, and it is the money. When the money comes into circulation in the county, that helps everybody. Some countries abroad, like USA, they give each household certain monies. If people are out of employment, they give each household, a certain amount of money. In our situation, of course, that is not something that is easy, although we sat down in cabinet and we said we want to explore a system where there is an employment guarantee situation like exists in India. In India, there is a law they call Mahatma Gandhi Employment Guarantee Act, where every vulnerable person, somebody without employment, like young people, anybody, you name them, are guaranteed 100 days of some employment. Just like the kazi mtaani, or what in Makueni we're also calling kazi ajira kwa vijana, so that they are guaranteed some employment. But for that to happen, it means you must minimize corruption, you must do away with wastage, so that there is residual money which will be invested, in terms of helping and cushioning one's citizenry.
That brings us to the end of our show. Your parting shot to the people of Makueni and Kenyans at large. Let us really take COVID seriously. It's not a joke. It's life-threatening. People, have died. People will die. This is not a threat. And these simple things that we are told to do, like wearing of mask, they really help a lot. The hand washing, we need to mobilize, of course, the water and the soap and so on. Even people are making soap. People are even making masks, like polytechnics. So let us really protect ourselves. And, although we cannot tell our people in Nairobi, Mombasa, in the cities where there is an upsurge, we cannot tell them not to come home. When they come home, let them, particularly protect the older people, so that we don't endanger. Because our experience, the people who are dying are older, and
Also, young people, of course, will die and are dying in other situations, but we have seen that since there was the reopening, older people who are infected, maybe by relatives who are coming from somewhere else, do not, have a major problem. So my message is, let us take care of each other. Let us be our brothers and sisters.
All right, Prof, thank you so much for your time. We do appreciate it.
And I thank you very much for this interview. Asante.
All right. Okay, and that brings us to the end of our show tonight. Thank you so much for watching. That has been Makueni County Governor Professor Kibwana on the county's preparedness in regard to the COVID-19 response. Thank you once again for your time. Wash your hands, sanitize, put on the mask, and stay at home where you can. I'm Purity Museo. Do enjoy the rest of our programming, and God bless.